We are activating your unique self-discovery one show at a time. The Orchard of Wisdom Self-Discovery podcasts are at your fingertips, just waiting to inspire and invite you in discovering just how awesome you really are and how to navigate through life in joy, enrichment, personal abundance, in mind, body, spirit, heart, and soul. All the people we bring you are here to serve you on your journey of life. Do enjoy our next show. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition Is Your Health is Your Choice, right here at selfdiscoverymedia.com. I'm your host, Sarah Troy, and my guest is Matt McBride. Are you having a hard time finding a doctor? Is it really hard to get in to see one? Have you tried this phone system and it's not working for you? Well, at Mend, they believe that innovation is the key to a better health outcomes. They exist to provide high-tech, high-touch digital patient engagement solutions that streamline operations and improve patient outcomes throughout the continuum of care. McBride is the CEO and the co-founder of Mend, an enterprise-grade patient engagement telehealth platform designed to healthcare organizations scale the practice and care for more patients. As an experienced entrepreneur, he co-founded Mend in 2015 with his three best friends to revolutionize the healthcare delivery. That is just something I think is pretty awesome. Health, it doesn't matter who you are, how rich you are, how famous you are. We all have at some times have got to face the fact that we're sick and we need help. And so, yes, those kind of people can get access to doctors, but it is so hard nowadays. I know here in Canada, we have a shortage of doctors here in BC. So many people without, it's number one concern actually above everything. And of course, across the board, we have an awful lot of doctors that were simply burnt out with COVID. And you've got more nurse practitioners coming up practicing, but it's still kind of done by phone or, by Zoom. And it's still a system that seems to still be kind of a little wonky. So you've been doing this for a while, and I imagine through COVID, this really escalated this ability to speak to people through this medium rather than, not being able to see anybody. Welcome to the show, Matt.
Yeah, no, thank you, Sarah, for that great introduction. And I think you described it perfectly on kind of what was Mend, what Mend was built to do. So thank you for that.
You were mending a system. COVID definitely put a strain when people couldn't even go and see a doctor. So this, I can imagine, would have escalated your business quite considerably because you have provided that access. And a system for doctors to use that is very simple for them, because we know that an awful lot of the time they have maybe 3 minutes to see a patient and then it's 10 minutes writing everything up. Yep. Right. So if they've got a thing where they can be writing it up as they're talking, it's in the system. They don't have to go and rewrite and put it in the system. So you're just making that doctor's visit through either the phone or through this medium more efficient, so they can actually see more patients.
Yeah, that's absolutely correct. And so, there's telemedicine is kind of one piece of what we do. Now, what exactly is telemedicine? I think it's, it's video with your provider, just like we're doing here. And then we also have that audio capability as well. So the ability to call a patient over the phone or call multiple parties over the phone. You may need a translation service, right? If you don't speak the same language. So yeah, that's definitely one part of it. And then if you sort of imagine going to a doctor's office, there's other things you have to do, right? You have to schedule an appointment. Maybe you get a reminder, you have to do paperwork. Yeah, maybe you have to make some kind of a payment or some partial payment. And so we support those things across any type of appointment with our customers. So, there's still lots of reasons why a patient should come in and we need to physically see somebody, but there's a lot of reasons why somebody doesn't need to come in for, whether it be because of a pandemic or they're too far away or whatever the case may be. So when we started building this product, it was really, that was our vision before the pandemic really kind of highlighted everything, is we felt in the future there would be some large percentage of virtual visits, but the in-person component was still going to be very important. And so we built everything in our platform to kind of work across any type of appointment, give patients that convenience and access. But then, like you said, on the provider side, there's lots of potential benefits to maybe solving staffing shortages, burnout, because now I can have better access to my documentation and my administrative work while we're in a session. So yes, there are, I think, a lot of benefits that countries all over the world have seen as a result of the pandemic. So maybe that's sort of one good thing to come out of the pandemic, with all the bad that occurred.
Yeah, I've interviewed a couple of doctors during the pandemic, and of course we're not out of it yet either. So, we talk as if it's past. It hasn't. It's here to stay in some form of form. And they talked about, how burnt out they were, or that they had signed so many death certificates in a short period of time, more than they had done in their entire careers. And, for an awful lot of doctors and nurses, what they're suffering from right now is post-traumatic stress. And there isn't enough doctors and nurses to come up behind them to fulfill that. So, there is also a more demand where we're actually missing people's diseases. My brother recently had a major heart attack. He was seeing a doctor kind of through this medium that really wasn't engaging. Like you've had the test. Well, it must be this, just take these pills. And that disconnect caused him to have a heart attack because those signs were not there. And I think it's great to have this platform for doctors, but that doesn't mean that they don't give all the time when they're in session with a patient. Marvelous for, like, you need new prescriptions. You don't really need to see the doctor for that. They can just, you're sending in something for a new prescription and the doctor say, yes, you can continue with this, or no, I want to see you before you do. And that can kill a great deal, eliminate a great deal of time and fuss as well. So there's so many areas where it's really, really good, but it still does lie on the doctors to still be diligent with their patients, to go, all very well talking to you like this, I do need to see you. And that can eliminate unnecessary visits and know which ones you really do need to see. But I still imagine it's a system that doctors are still trying to work out themselves. So who do they see and who do they not?
Yeah, I think what a lot of doctors have done I think, a lot of the sort of the situation you described where the person ended up with a heart attack, right? If they had come in and gotten all of the vitals checked and the stethoscope and all of those things, perhaps something they would have said, oh, well, you need to be, let's run an EKG and let's take, maybe those things, maybe they would have saw those signs, right? And so I think there's still some work to be done there. And what we've seen talking to providers is they have adjusted, tried to come up with new methods of a physical examination, even though we're over video. And so maybe trying to, have the person talk about their breathing, or, maybe having them make a movement in the camera, so on and so forth. Or, some of our providers do is they may ask the person, to get their blood pressure at the local convenience store and report that, or maybe you have some of these devices or access to some of this information at home and sort of self-report that information. But here's where things are going. In the very near future, doctors are going to have access to the majority of your vitals right through this web camera. This web camera is going to be able to, communicate to the cloud. Artificial intelligence is going to be able to say, this is Matt's heart rate, this is Matt's breath rate, heart rate variability, this is Matt's blood pressure, stress index, mental health index. So I think then that really, I think, provides the decision support,
right,
for providers to do more virtual, and not lose maybe what they would catch if it happened.
How is this going to work that they can do that testing through this device? I mean, is that in play yet, or is it still in progress of being developed?
I would say it's in the progress of being developed. I've seen these tools available already for educational purposes only, because clinical studies are ongoing. The FDA is having to, at least in the United States, we have the Federal Drug Administration. They're trying to figure out a new class of medical device for these types of technologies. They're calling it medical device in the cloud. So there's actually a Canadian startup, Neurologics, that's working on some of this type of technology, and there are other companies working on this type of technology. So I think I've seen it work very well for sort of educational purposes. I think once it receives those clearances from these federal organizations, and it's undergone the clinical studies and the scrutinization and all of that, I think we'll see it in use, and I think that could really be a game changer, because then you're not really missing that much from an in-person visit. You can almost replicate an in-person encounter, the majority of the time, but through a virtual setting. So that's definitely where things are going. Probably still a few years off.
No, I can definitely see how that will make sense, because there's a lot of people. I had terrible bronchitis a few months ago, and I have no doctor, and I had to go to emergency. And you're sitting sick, and I was 4 hours only. We had to take my grandson with the same thing, and we were 5.5 hours there with the baby. And you're sitting in a room with a whole load of sick people. You're uncomfortable, you're not feeling well, and these poor doctors are just so utterly drained because there aren't so many of them. And unfortunately, a little while ago, because there was so many in emergency, one guy did die before they managed to get to him. And that is because we have the shortage of doctors. But if we had that system where they can do all the preliminary, you've got this is the medication for you, these are the symptoms you're talking about, or please go and get your blood pressure tested, go and get your blood tested, and then we'll have another call and I can take up the next further one. Or then judge, no, I really do need to see you, or you really do need to go here and there. But I imagine that it breaks things down so much easier for them in kind of eliminating what the problem is and getting to the diagnosis. So it really is, whereas we used to hand ourselves over to the doctor, what's wrong with me, doc? Now we're actually partnering with our doctor to discover what's wrong with us. So we're being more interactive with our own health and the doctor, because we are going to have to go and do a few things on our own to come back with that information.
Yeah, and I think all these other industries are creating these types of conveniences, right? Where, just take booking your airline ticket. I mean, you can put in all of your information. You can pay for any additional luggage that you have. You can pick your seat. You can maybe even plug in what kind of meal you want, or allergies, and like you can do all of these to get your boarding pass, and you just kind of show up, and everything is done in advance. And I think that's definitely where we're headed, creating those types of check-in experiences where you do all the forms. We're going to have all the vitals through the webcam, any payments that need to be made, all of those things will be done. And then the healthcare organization can really just focus on customer service, care. How do we get this person healthy again? And so that's definitely where things are headed. Healthcare is a little behind, and I think we share a lot of the same problems that Canada is seeing with shortages and burnout and all of those things. But at least it seems like we've got a good push in that direction now that will hopefully solve a lot of these big problems that face all these different healthcare systems all over the globe.
Yeah, and we do have this. It isn't all over the globe thing, and we've seen with the pandemic, so many things are having to pivot, and we're not going to go back to the way things were before. There's too much that has changed. The infrastructure of everything has changed. A lot of people aren't going back to the office per se. They made themselves at home. They're still productive, and they don't want to go back to the office. This is less stress of them, of traffic and this and that, and it's much easier just to do this. And if you've got people that are more relaxed when they're doing something, they're going to do it better. So I love the idea of this artificial intelligence where we are able to tell a heartbeat and this and that, over that would be fantastic. I hope that comes out soon. But in the meantime, I think, is there a form that a patient signs up with your program that puts in what, all the things they're feeling so the doctor can see it when they've got, before they take on the patient? They can look at that form, they're complaining about this, they're complaining about this, their history is that. So even before they even say hello, they've got some information.
Yeah, so we have digital forms as well, and we can collect all, any information that we can get pictures of their medical insurance card or their ID. We can get all their allergies, all their prescriptions. But I think, I think one thing to consider is we're all sort of used to thinking about the doctor's office when we get that maybe scratchy throat or
Yes.
that congestion or whatever. But there are a lot of folks that are just managing different chronic conditions, or they're getting mental health care, or seeing a therapist, or things of that nature, where it's not so much that the doctor even has to diagnose as much as just help sort of monitor and maintain. If you had diabetes, or you had high cholesterol, or low, high blood pressure, low blood pressure, whatever. So I think there's a lot where, the doctor just sort of is monitoring, and there's a relationship, a pre-existing relationship, maybe that's gone on for years, right? And so I think there's a big percentage of those types of appointments as well, not just maybe the
one-timers.
The little urgent care stuff.
Right. No, and I think that is wonderful. And the benefits of that is that this patient's history, you're monitoring it along with them. If they have concerns, it's generally valid concerns, but the beauty of it is they can make an appointment, right? Those concerns are shared. The doctor now can assess, and when calling back, the other thing, if you're working, you're not having to take time off to go and see the doctor. You can book it during lunch hour. It generally is only a maximum 10 minutes anyway. And nobody has to get the car to go anywhere. I mean, one of the worst things is somebody is coughing and spluttering, all over you. And the last thing we want is to be anywhere near you, whether it's a common cold or, of course, we all assume COVID nowadays. We want you to stay at home and a doctor to prescribe what you need, right? We don't want you out there. So
please stay at home.
Huge please. Even if it's a common cold, those spread like wildfire, and we would just like you to stay at home. Now, have you also aligned with like pharmacies for delivery, or is that something the doctor aligns with pharmacies to deliver patients so they don't have to go and get them? Is there that system in place?
So in the US, we'd call it e-prescribing. And usually the e-prescribing is connected up to their system that is in charge of all of the patient medical records. So, they should have all of your existing prescriptions in there that you provided, or anything that's been prescribed. And then, there's a database of all of the pharmacies. Some of the pharmacies will deliver to your home, or through mail order, or if you've got one at the grocery store, convenience store, or whatever. But I think in most cases, folks just say, well, this is my pharmacy. And then the doctor can just go in. If they want to prescribe something, they can do it electronically. So I think a lot of that was sorted out and modernized, but some of these other things were not.
Right. I mean, let's face it, a lot of our main doctors got ridiculed, and now they're being ridiculed, because in the beginning they said no masks, and then it was no, you need to wear a mask, and no, this incubation time, no, that incubation time. And we've got to realize they were navigating something that's never been navigated before. And the fact that this was worldwide, not just one country, worldwide, it was, as things were happening, they had to adjust what needed to be done. And it's all very well people picking on them, but hindsight is 2020. When you're in it, sometimes that sight is zero and you're literally going blind. So I imagine there's an awful lot of innovation that has come about in the medical world because of the adjustments that they had to make through COVID. Do you feel that in a lot of ways it's propelled this new system, escalated it further into the future now than it would have been? Like it would have been, you know, maybe a few years before people really would have got into it, but now because of COVID, it's really pushed the everything into fifth gear.
No question. I think the first point I would make is, you know, if you just, even if you just look at telemedicine and how the entire world changed overnight with telemedicine, right? It went from, you know, 0% to 50% or more literally overnight. So I think, you know, from that perspective, you know, it seems like change is really hard, especially at a global scale, but the world did it and did lots of other things, not just telemedicine, to try and adapt to this. But I think that, you know, we touched on remote work a little bit, and you know, most of our company is remote. We were sort of half remote before. But I think that, you know, doctors got to see and got to taste remote work as well.
Yeah.
And I think given the demands, given the burnout, the administrative tasks, I think that providers saw a lot of the potential that virtual could bring. Different healthcare organizations and systems saw digital is going to be a key part of the future, and it can do a lot of very interesting things. And so, you know, I think, you know, another innovation is really remote work for providers. And I think that opens the door to take, you know, being able to take providers that are in urban populations and maybe have them help folks in a rural setting.
Yeah.
So, you know, sort of being able to access providers from much larger geographies, or giving, you know, providers those flexibilities where they don't have to spend as much time commuting, because, you know, they're trying to have a life and they've got documentation and they've got all these things to do. So I think, you know, that's another innovation that we'll see, is this concept of remote or hybrid work for physicians and nurse practitioners and other types of providers in the space.
Yeah. We have to adapt, don't we? Now, of course, there's still a lot of people out there, you know, especially elderly, that don't have computers. So this obviously is not going to serve them, because they, you know, I live with an 89-year-old, she's got a computer there and she just plays a couple of games on it. And other than that, she won't even look at her email, doesn't know how. So it's Sarah, you know, come in and do everything for her. And she doesn't want to do much online. You know, she's at that age. I don't want to have to learn this new thing. How does that work with them, or doesn't it work with people who don't have any of that type of access?
Yeah, well, I mean, I think that unfortunately, it can result in no-shows.
Yeah.
Right. I mean, if that family member or that friend or whatever, just, I mean, you know, looking at my grandma as an example, she just doesn't want to go in.
Yeah.
Right. And has a caregiver, right? Somebody who could operate the technology, who could probably facilitate the telemedicine visit. So, you know, it's not, you know, perfect, and it's not a solution for 100% of the time. And I think there are going to be those cases, but on the other hand, I would say that it's a common assumption, and I would say in a lot of cases, whether somebody has said, well, we have a large homeless population, or we have a large, you know, an older population, I've seen more times where there's been a lot more successes than failures. There's going to be some failures there, and there's going to be some people who don't want anything to do with the technology. And then we have other options and we have customers that have even set up other options where they've set up kiosks at a grocery store so that those people don't have to travel all the way across town. They have a shorter drive to a kiosk, and the provider could be remote. Or if you don't have access to the technology, you're not comfortable with the technology, you come into our location and we'll take care of the technology for you. So we've seen people adapt in a lot of different ways, but then there's going to be people too who just no show and just don't stay on top of it too.
Right. Yeah. And I can see with the homeless people, where the soup kitchens are, or even the churches or something like that, having it set up. The doctor is there for a few hours, through this medium, and the homeless people, you can come and talk to the doctor on this day between this time and this time. And then, each person is given around 10 minutes, and the doctor can assess, do they need further? Can they just have a prescription? Can you tell them what to do? And that can be assisted by either the church, which I believe should be there for the people, or the soup kitchens, or the, Salvation Army. I mean, this is something they can set up for homeless people, or even the elderly who don't know how to do it. So there's, as you said, there's always a way out, and you've got organizations in place. And I would think there would be fantastic candidates for this, because they're the bridge the gap between for a doctor to leave their surgery and come in for the day to see someone is so much harder. And this way, a doctor can carve out a certain amount of time where they're going to be seeing whatever patients there, and then we're not going to lose people through the cracks. So, this is a wonderful bridging gap if we can get those other organizations to be that bridge, for the homeless or the elderly, or even some younger people who can't afford a phone or a computer. There's plenty out there, but set them up, organizations, set them up.
Yeah, I think there's lots of broad applications for this. Schools in the United States have become a place where not only are kids receiving education, they might be receiving the majority of their meals and even receiving healthcare, right? So having these kiosks in schools, to even different types of shelters, foster homes,
yes,
all sorts of different places, crisis intervention with some of the craziness that's been going on, and just being able to virtually just provide that care on the spot, go to that person's location, that patient's location, and not have to spend all the travel time. So there's lots of different use cases that we've seen over the years. And so, it's easy to kind of think, well, it's, to just sort of assume, well, it's not going to work for this group or that group. But a lot of research has been done since the pandemic in the United States, probably in Canada and other countries, just on health equality and what's happened with the use of some of these technologies. And I think what they're finding is that this technology and the access that it brings is really helping to increase access to care, but amongst some of these populations that maybe didn't have as great of access, as others. So I think from a health equality and equity perspective, there's definitely big gains to be able to provide more care and help more people.
You used to have a doctor that served a community, right? And then, of course, communities got bigger and bigger, and you had to have more and more doctors placed around the place. And then it kind of almost got disconnected from the community. And in a way, a doctor can be a community doctor again for a certain community. And that way you've always got the record of that person's health. It's in their system there. It doesn't matter where they go. And it's another way of a doctor being able to reach out and help people where they don't have the time. One of the problems here with the doctors is the funding they get from the government does not cover their expenses, because our expenses here, properties and rents for, a medical office is extremely high. Then you've got all the staff, you've got everything else, and they're just simply not making it. That could be not eliminated, because I imagine, doctor still needs to be seen, but you have got some doctors, especially that are closer to retirement, that don't necessarily want to have to go into a surgery anymore, that they can actually do this from home and do just this, and especially serving their communities where their communities are vulnerable. And they're not required to go anywhere, just have the computer, have all the systems set up, and they can even refer to other doctors if it's something that needs to be seen beyond. So in a lot of ways, it's building that lovely spider web, and it's inclusive of everybody, depending where they are in their life and what situation they're in.
Yeah, I mean, I think we've seen, how about the physician that's also trying to start a family?
Yes.
That has to, maybe split time between the needs of kids and a growing family, and maybe they can only do part-time.
Mm-hmm.
Where I think telemedicine kind of creates that opportunity to maybe to be a little more part-time. Some of the sort of early telemedicine companies within the United States that were doing things over the phone really started to tap into providers that had some disabilities that could really, it was just easier for them to do work over the phone and see some patients over the phone. So that access to care really works on both sides, and we can tap more people, and like you said too, seeing more nurse practitioners enter into the equation. We're seeing that as well. Nurse practitioners or physicians assistants kind of being able to take some of the workload. I think there's a lot of reasons to keep moving in this direction. And there's some, I think there's some hiccups from time to time too. I mean, if you don't have a great internet connection or great cellular reception, you might not be able to have a clear phone call or a clear video. Those things, there just isn't a perfect solution, but having these options available in the long term, I think everybody's going to benefit.
Yeah, I think in a lot of ways it's a reconnector, because there's so many people on so many different levels that how could you afford a surgery and only work part-time? Or, you are building a family, but gosh, if I have a surgery, can I have a family? Because I can't have both. Where in this way, that part-time, and there's a lot of doctors that I really do want to retire, but I know I've got still something left in me. Well, this is something they can pre-retire to and still feel good about serving patients, but doing it again from home and not having to have the big surgery and the overcosts and everything else. But the other beauty of it is that they know all the other doctors and whom to send a patient to if they need further care, from a surgery or from anywhere else. Because I think it builds up a better web between the doctors knowing each other and knowing I'm sending a patient to you, da 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 da. And then when that patient gets there, the person knows who it comes from, knows that it's not kind of up in the air, and knows what to do with that person. So I think it's building an interaction between all the practitioners as well, a way of not competition, but collaboration.
Yeah. I mean, and I think even being able to have access to specialists, maybe you end up in an emergency room, right? Well, the ER doctors can only do so much, right? They kind of try to stabilize the situation, stabilize the person so that, they can sort of move them on to a different specialist. But now you could maybe just remote that specialist in right away, or, instead of calling that doctor, getting them out of bed in the middle of the night, making them come in, perhaps, they can just do it, over the phone or through video and provide that care. But I think, you touched on something too, around, providers that want to retire, but maybe still kind of keep going. But I think, there has been a lot of stress on all these different healthcare systems And there's this buzzword of the Great Resignation, and I think we've seen that in healthcare as well. We actually have a webinar and an ebook coming out, sort of touching on the Great Resignation, remote work, hybrid care, and how some of these things can help these different organizations. But I think right now that there's probably a lot of providers that are maybe thinking early retirement.
Yes.
How do I get out of this system now? And so that's only going to contribute to the problem. So we're still figuring out how to live with the pandemic. Now the pandemic has really created a lot of burnout. So that's something that we really have to think about. And I think that's a big issue that a lot of healthcare organizations are trying to sort through and navigate as well.
I mean, it doesn't matter who you are or how old you are or however much you want to turn the clock back. And it reminds me of the book Who Moved My Cheese by Spencer Johnson. I don't know if you've read it, but it's a really good book.
Yeah.
The two mice and two men over the cheese, and the cheese is gone, and there's the different reactions, which comes from their different perceptions. And you've got Sniffy and Scurry that goes and sniffs out and scurries around for more cheese, and Hem and Ha. And Hem, sue, I want to sue someone, I want to kill someone, give me back my cheese. And Ha going, geez, I better go and do something, I'm hungry. Right. And to identify with which personality, because I'm a true colors coach too, so identify with your personality is to identify your resistance to something. Are you a person, I'll give this a try, see where it goes? Are you a person that you have to wait until you're desperate before you do it? And are you a person who isn't going to do it no matter what? And I think we're going to have all of them on the spectrum, on both sides, the patient and the doctor. But I think for all of those burnt out doctors that just don't want to be in an ER anymore, especially those, this is a wonderful way of them still staying in medicine without having to be all around that, static and pain and anguish that they were in on. I think it's a wonderful way for them to still stay in medicine and still serve, because they got into medicine for a reason, but at the same time, not be chewed up by it, being chewed up by them, because I know from the people I've interviewed, it's just that it took so much out of them. And we have to respect that. How can you, day in and day out, people dying on you, they're dying alone, they can't have their loved ones there, and then it's on to the next patient you're trying to save. It's like a battlefront they were at war with. And we know that all of those soldiers come back with post-traumatic stress on some level, and this is what they have right now. But that doesn't mean that they want to leave the profession. That took 7 years to get, right? So this is a way of them stepping back into it in a way that's much easier for them. And if they do want to go back, quote, quote, to the front later, but they can still see and serve patients without it costing them as much emotionally.
Yeah, I mean, maybe some do decide to retire, but then this is a part-time option for them. I will say that it really seems like behavioral health is going to lead the charge in a lot of these technologies, just because you can really do everything virtually. You can do a lot through telemedicine. And so I think you're right that it's probably hard for most of us to even understand what it was like to be on the front lines and see what they saw. But even maybe being able to give care to providers, right? Give behavioral health care, mental health care to providers. That's another way that telemedicine can be leveraged for care too. But then, maybe there's still an opportunity to help some folks, but doing it virtually, doing it through telemedicine, and still being able to help people, which is probably why you became a doctor to begin with.
Yeah. I mean, imagine this is really good with mental health therapists, psychologists, because maybe people can't get in or they're still nervous to go out. And there's an awful lot of people that go through these anxieties and they just don't even want to leave their home and go to an office, right? And if they're in their own space where they feel safe and they're having a session, with the psychiatrists, psychologists, therapists, whatever, they're in their safe space. And I think that there is more for them to reveal than feeling I'm on the couch in an office, you know. And I think there can be a lot of benefits because there's a lot of intimacy that you can actually build up this way. Everybody's in their safe arena, and now you can really be open with each other. So I can see a great deal of benefits with mental health and supporting people through stressful times as well.
Yes, and I think there's a lot of flexibility. I mean, let's take the example of maybe a physician who, saw some terrible things, and they have a really busy schedule, a lot of demand from patients. So maybe being able to have therapy from their own office, to maybe you have a single parent, right,
Yes.
who's got to work, who's got to take care of a child or many children. How do you coordinate the time to get help or get therapy? But if you can, maybe have some flexibility with your therapist, maybe you can do it in the evening. I think there's so many different ways that people have seen where this is creating more of a positive. I mean, we've even had customers before the pandemic that went almost all virtual. They got rid of the locations, got rid of that expense, because you talked about, groups in Canada that really struggle with rent and, all of the expenses. Yeah, I mean, a lot of it could potentially just go away, or maybe a significant percentage of it could go away, and maybe then it will become, it would make more economic sense. So there's a lot more benefits and value that we've seen over the years, especially because before the pandemic, we were working with a lot of early adopters of this technology. So we were working with a lot of pioneers, and they were the ones who were, weren't afraid to go, well, let's try this thing and see where it goes, right? But now, I think the rest
becoming more mainstream.
Yeah.
And of course, I think what we're going to see, whereas a doctor's office is only open from this time to this time, we're now going to be able to see 24-hour service. We know that fevers may start in the night. A kid wakes up in the night screaming in pain. That's when you want to be able to get on with a doctor, and having doctors go, I actually prefer to work evenings or work through the night. There's some people that are the night owls. And so we're going to see a great deal more of that, I think, where it's going to become the 24-hour availability rather than just the 9 to 5, or you've got to go to emergency if it's anything after that.
Yeah, I mean, we've definitely seen some customers start to offer that type of service, that completely virtual, 24/7 urgent care access. I definitely, we've seen that. I think even in the behavioral health space, just the providers having flexibilities, therapists having flexibility to work in the evenings or weekends when their office isn't open, or maybe they don't even have an office anymore, right? Maybe that's more convenient for your schedule too. Maybe you're a therapist, you're dealing with the family and everything during the day. It might be more convenient for you as well to provide care at different times. So there definitely is that aspect as well. And you don't have to have the location, have somebody sitting at the front desk, having somebody there to take all the vitals. You don't have to have the whole operation up and running. If you have this established relationship, or maybe it's something relatively minor, we can connect like we're connecting right now, and you can get some expert advice from a provider, and hopefully that takes care of the situation for you, and it doesn't turn into anything emergent.
We're seeing a great deal, even way before the pandemic, the shared offered space. You could book your space for that day in the office, or book the meeting room, but you didn't have to have it all the time. So, people kind of booked it. It was there. I could see it coming up with a medical space where you have the permanent nurses there, the reception and everything else, but the doctors will book a time to come in there when they know they actually have to physically touch a patient, right? And they're only booking a certain amount of time, but they haven't got the massive overheads because it's booking space and time, and that I think is probably an excellent way for them to go. On such and such a day, I'll see you at da-da, and you're going to be there for a few hours. You've paid for that time. The nurses and assistants have all that you need for that, because this is more the hands-on physical stuff that you need to do, but you don't have the permanent overheads all the time. So just as we had shared office space, why can't we have shared medical space?
See, Sarah, maybe you just came up with the next, WeWork idea, but for doctors.
It makes sense to me.
Yeah.
I mean, a dentist not. A dentist can't do virtual. They have to be in your mouth. But for a doctor, okay, no, we've tried this and we've tried that. I really do want to see you now. I need to do the touch, and then book the space. And that, there's one person that obviously can be the enterprising person with the building, with all the medical stuff in there, and the doctors book the space as they need it, and they don't have to carry the overhead 24/7. Right? They can concentrate on this, and then, okay, every Friday at such and such time, I want that space. You can have permanent nurses and everything else there for assistance, right? To get the blood off, or get the testing off, or get this or that off. And it just makes sense to me. You're not losing the surgery for when you need the surgery, but it's not having to be the surgery all the time. I'm carrying a surgery and doing this telemedicine. This doesn't make sense. Why don't I do the telemedicine and there is a surgery I can rent?
Yeah, I think one of the best examples I've seen, and a doctor that I interviewed is working under a virtual first primary care model. And so what that is it's 4 days of virtual care with his patient panel, 1 day of in-office. So if they need the in-office visit, that's on Fridays. The rest of the week is virtual. But in order for that to happen, in the US, value-based medicine is becoming a big trend. The government is basically saying, look, we're going to cut these people. Here's the money. Don't just try to rack up all of the billing. We're just going to give you a global payment, and you're going to care for these people as effectively and efficiently as possible. And it's kind of interesting to see then this sort of virtual first primary care offering. And to your point, that's, 4 days of remote work, 1 day in office when you need it.
Yeah.
And there's really not a lot of waste in that sort of system. So that seems to be a trend that hopefully will continue to play out. But I think a lot of organizations could look at that, and that could be a really good model. It seems to be appealing to the physicians. You can have that remote work, hybrid work model. And I think it's appealing to patients too. Because
and you've got enough doctors doing it. This one doctor has the clinic, the space on Monday. Another one has Tuesday. Another one has this and that. You can even go through the weekends, where an awful lot of people don't want to see the doctor during the week because of work. They want to see a doctor at the weekend. And this way, I could just see, you've at least got 7 doctors to 1 surgery. Right? Whether it's 1 day seeing a patient and the other is all virtual. And that means there's always somebody in that surgery. And if there are more doctors in that community, then you can have more accessibility of rooms for this. Several doctors could be there at once, but they're paying for those days that they're there, instead of having to pay the overhead for 30 days when they're doing, 28 days or 26 days of virtual. It just makes logical sense to me. And it could be an extremely good enterprise for the people who want to set it up.
Absolutely. So, hopefully not too many people will just go back to what, the way things were. Hopefully
I don't think we can
see this.
Yeah, I don't think we can. I think, there's a beautiful Celtic room that says Haglas, disruption. We're still in disruption. We're still kind of shaking things up and seeing what falls out. And we realize there is no going back to what was. There never is ever going back to what was. It is what from the past is something we cannot lose, that is needed to be incorporated in a new paradigm, in a new way of doing things for the future. This is the future, whether we like it or not, but we can still have both. If the doctor has access to a hands-on surgery where you know you can actually go and physically see someone when necessary because you've had the initial consultation. And, you know, if you're just needing prescriptions, hi doc, I need a prescription. How's it been going with this? How's it been going with that? No problems, no problem. Prescriptions to your thing, and then 5 minutes it's done, right? You know, it's efficiency. But the diligence, I think, has to be on both sides. One, the doctors are going to probably have to ask different type of questions because they're not touching and feeling. And we as a patient need to come up with, well, the pain is here, I don't know where. You know, you need to be more defining in what we feel the problem is, as opposed to kind of coming in and going, I don't know, I just don't feel good. You know, why don't you feel good? When do you not feel good? When is this happening? What is happening when you're not feeling good? Come in with the information to share with that doctor so they can deduce. And so I think, again, as I said, whereas in the past, we've just handed ourselves over to the doctor. We've got this show is called Your Health is Your Choice. So, you know, we need to actually make better choices of our own health, but also hold more accountability of how we're going to speak to a doctor and what we're going to need from them, instead of, you know, just saying up to the doctor. Yeah, ultimately it is, but they need information. So be coherent with what information you give them.
Couldn't agree more. And with more virtual, folks are going to have more choice.
Yes.
So there's gonna be more options, you know, beyond just the 9 to 5 and beyond your, you know, your local community and your geography. And so, yeah, I think folks are going to have a lot more options as well. I
can see it being 24/7. I can see it being both the virtual and, as I said, the access to the medical, to your same doctor, you know, on a certain day. They can book you in. They already know preliminarily everything. So now it's just taking it that next step. So it's not having to start all over again, right? Or they've sent you for tests in the meantime, and now they're going to physically see you for that next stage. I just see the efficiency of it. If it is run efficiently, and that we know that you can have a great system and human error. So doctors are going to have to change the way they ask the questions. They're going to have to change the way they approach their patient, and the patient's going to have to change the way they articulate what's wrong with them.
Couldn't agree more. And I think it's happening more and more, and I think we'll continue to see more in the future. So
yes,
definitely exciting from that perspective.
So this is obviously a program for doctors, for the nurse practitioners, for psychiatrists, psychologists, anybody along that line. They can sign up with you for this whole program, and then you have an entire program laid out for them and how to use it, how the system works, how it accumulates knowledge.
Yeah, so we have a sort of lightweight free option, maybe for solo practitioners or smaller groups. And then we have an enterprise platform, but still very affordable for larger healthcare organizations. You know, we work with really large groups to medium-sized groups that, you know, want to have that sort of have an organizational strategy around patient engagement, telemedicine, automating patient payments,
or as you said, insurance as well, whether if they have a health insurance, automating that. Yes.
Yep. So yes, this is something where you know, we can put the healthcare organization's logo and name, and we can solve a lot of these digital touch points, whether it be before the visit, after the visit, or if we're helping to actually conduct the visit with telemedicine. It's something that we really have some solutions for any size organization. So Our website is mend.com, MEND.com, and
Very easy.
there's a lot more information there.
Yeah, not only mending the people, mending the system for the practitioners and mending a system that is broken. And, and imagine that, for a doctor, while they're talking to you, they can be programming it, this pain here, that pain there, it's already going into the system, it's on file. I know my own doctor, before he retired, would, after he saw a patient, go in and type it all in. And then, you've had other doctors, like at emergencies, typing it in while they're talking to you. So again, it depends on the efficiency of the doctor, but that means it's their real time. It's on file, right? So when you come back, or if they have to refer you, it's there.
Yep.
It's all there, documented for them. And as you said, payment and everything else, the admin takes so much of their time that they lose the time in seeing the patient. So the easier the admin and the intake forms and all of that is done, because that's all done before they even get to see a patient, right? Everything is done before they get to see the patient. So all they're having to put in is either diagnosis or whatever is wrong with the patient.
The average provider in the United States is spending 4.3 hours a day on documentation and administrative tasks, right. maybe even above and beyond their sort of their work hours.
Yeah.
So that's a huge problem. I think there's definitely opportunities there as well. In the near future, maybe AI will listen and just do all the documentation automatically. But these are things we have to solve. Telehealth definitely is a step in that direction, like we said, because we can see each other on video, and I can see your chart and document as we go along.
Right. Question: people who are deaf or people who are blind, do you have a system set up for them?
Yeah. So what would happen if deaf, American Sign Language is typically scheduled in a lot of cases, or even potentially available on demand, maybe through video or something like that. But a lot of times it's scheduled, so they can attend they could just be a third person in this session. If this, if this was a patient and a provider. And so that's something that we have customers doing. So that resource could be scheduled and attend, or maybe they already have that resource on staff. I think even a more common situation maybe is folks that don't speak the language. The provider and the patient don't speak the language. So we've made it very easy to bring, a translator in within, just a few seconds, 20, 30 seconds, get a translator in that can translate back and forth. So there are definitely workflows to solve any sort of language barrier. And then our system can communicate in the patient's language too. So if we're sending a reminder, giving them forms, providing them with any technical support. So yeah, that's another big part that has to be addressed, given that, like we said, everybody's a patient, right? Even doctors are patients.
Right. So no matter what their language is, they can fill it in their own language, and the doctor can translate it into the language they want to receive it in.
Yep.
Right.
Yep.
Great. So nobody's left behind.
That's the idea. Help more people.
Right. Now, are you only in America right now?
Yes, pretty much in every state in the United States. Canada, there's definitely been some interest there. We've had some customers in some other countries like Australia and other places. So there's definitely some opportunities there, but we do primarily focus in the United States.
Right. Hey, Canadians, get with the game. So, this is the way of the future. And the thing is about it being the way of the future and being escalated so much at the present moment because of COVID, this is also a time where the doctors can actually tell you what they need to make it easier, for what you can change in the system that makes it easier for them, and so that you can better serve them because they're busy serving us.
Yeah, absolutely. And we get a lot of feedback. We try to do provider town halls with customers and, not just have feedback funneled through whoever might be the point of contact or a project manager or something like that. We try to do town halls and get that feedback from the front lines. We also provide instant technical support for patients and staff and providers, so we can get that feedback from the patients, even if they're struggling at all, staff, providers. So that's really important to us, and that definitely goes into our roadmap and how we shape the product.
Excellent. And continued growth. So mend.com, right?
Easy. Easy as that.
So if you're in the States right now, which most of my clientele is, talk to your doctor about it and saying, this might be something you want to look at because it will ease up, your whole schedule. And also for an awful lot of patients who still don't feel secure in going out or sitting in a waiting room for an hour to see a doctor, or haven't got the time for it because they're working or got kids or got this or got that. It's not... It can't replace the actual hands of when a doctor needs to feel something, but that's why that one day a week, having access to that and the rest of it in telemedicine, I think really does make sense. It is the way we're going, so we may as well learn from it now, adapt, and the patient can also put forth, I don't like this question, or I don't like that question, or you're missing something, you need to ask this, and you're willing to listen and adapt, right?
You have to.
Yes.
We all had to adapt with the pandemic as well. But yeah, absolutely. I mean, it's still very fluid and very dynamic. And how do we take some of these digital solutions, and how does that play into long-term strategy? So still a lot of work to be done. And so yes, still have to adapt and synthesize a lot of that feedback, and we do that for our customers regularly.
Right. Growing company, adapting, adopting, and branching out to the needs for you. Mend.com. Talk to your doctor about it. Talk to your nurse practitioner about it. Just start talking to each other about it, because I know for some people it's a hard change to talk this way to a doctor rather than going in and seeing them. But we've got to look at, we have to be flexible as patients, and we've got to understand doctors are also kind of pretty burnt out, or there's so many more people in need of a doctor that this is easier on them as well. And if it's easier on both parties, that means more can get done and assessed. So health is important. Your health is your choice. So talk to your doctor about signing up with this, men.com, and making it easier on them and on you. So thanks so much for sharing with us today, Matt.
Yeah, thanks for having me, Sarah. This was awesome. Appreciate it.
My pleasure. Until next time, folks. Bye for now. We hope that you enjoyed the show. Find all of our shows on selfdiscoverymedia.com under podcasts or selfdiscoverymedia/shows. And for all our current shows, go to What's New. We are supported by you, the audience. You'll see a nice big shiny blue button for one-time donations, or follow us on Patreon and you will be able to support us there. We enjoy bringing you such wisdom. And the next show will be up in just a moment.